Let me tell you a story. So 3 weeks ago, I attended my first patient advocacy summit at Alkermes. Alkermes is in central nervous system drugs, predominantly severe depression, schizophrenia, as well as opioid use disorder. So a lot of focus in these meetings was about the patient journey, treatment options, and sharing of the life experiences. Again, somewhat through the lens of how we normally think as an industry. The aha for me was at lunchtime, sitting down with the head of an advocacy organization, and I, of course, was peppering him, as I normally do, through the lens of a pharma guy. And I said, hey, what's important to you in terms of the patient journey? Had no idea what I was talking about. What's important to you in terms of the treatment paradigm? What's a paradigm, right? That stuff is our speak, right? So after a conversation that went on for about 30 minutes, he finally stopped. He says, the number one thing we're trying to accomplish, whether it's major depressive disorder, schizophrenia, or opioid use disorder, is stay alive. Stay alive. That's it. So all of a sudden you go from your paradigm of journey to it's about staying alive. So from there, the discussion was, tell me more about that. He said, well, for us to stay alive, it's really about people that are willing to treat us with dignity and respect and authenticity. We can smell BS. We can smell ulterior motives. We can smell when people don't really care about us. So if you're going to be successful in delivering patient value as a company, engage with authenticity. Those are his words. Don't BS us. If we feel like you're willing to engage with authenticity, we believe you'll be able to hear stuff you've never heard before. And if you're willing to hear stuff you've never heard before, we believe that you're willing to be a partner with us. Historically, we work with so many companies that tell us what we want to hear, that meet with us, say they're going to do something, and it doesn't happen. He was well-versed in legal and regulatory workings of companies. At the same time, it's about how do we break down those barriers and find a way to deliver on their needs. So as opposed to us always thinking in terms of clinical terms, it's definitely interesting when you engage authentically to be able to get shocked into reality. The number one objective is to stay alive.